Thanks, Ben, and good morning. And can I also, on Are You OK Day, just extend my thanks to all those mental health professionals working out there at these really challenging times across our state, and everybody who's checking in on their mates, their families and their loved ones to make sure that they're doing OK, and to offer those kind words of support at some very challenging times for very many people. In terms of the cases today, 324 cases, a very challenging number indeed. And the pattern continues to be very similar to what we've seen really over the last 2 weeks. We have 102 cases in our western suburbs, including suburbs such as Werribee, Tarneit and Altona North. We have 195 of those new cases in our northern suburbs, including suburbs such as Craigieburn, Glenroy, Roxburgh Park and Broadmeadows. We have 5 cases in our eastern suburbs. We have 20 cases in the southeast, in locations such as Keysborough, Narre and Hampton Park. And we have 2 cases in regional Victoria. Let me just talk to those briefly. We have a case in Shepparton, a primary close contact of a positive case we've known about. They're in isolation, we're not too concerned. And 1 case in Mitchell Shire, a primary close contact of a case we identified yesterday. We have 1 further case that we're just trying to lock down the location for. That brings us up to our 324 locally acquired cases. The distribution of our active cases, again, are also quite similar. So over half of our active cases now are in our northern suburbs. Over a third of our active cases are in the western suburbs. And then really we have around 4.5% still primarily in the Shepparton area. Those are old cases that are coming to the end of their infectious period. And around 10% across the southeast and eastern suburbs of Melbourne. So we still see a very clearly defined picture, but we have, as Ben's explained, significant concerns around deep-seated community transmission, particularly in our northern and western suburbs. Just in terms of regional Victoria, now is it even more important than ever, particularly for regional Victorians, to really stay very closely on top of their symptoms and any potential exposure sites. I'm pleased to confirm we've had no further cases in Mildura following the positive case identified yesterday, and no further positive cases identified in the Bellarine. And the Latrobe Valley case that we reported yesterday on the second test had a negative test. That individual has gone to our expert review panel, and hopefully we'll report back on that in the next day or 2. There are 3 sort of locations or 3 particular examples I just want to give. The aged care facility we mentioned yesterday in Moonee Ponds, where we have a staff member who had been fully vaccinated who was a positive case. Pleased to confirm with 105 out of 106 residents have all reported negative test results. We're awaiting 1 more test result, and all staff results back so far are also all negative. And the aged care facility in Gladstone Park that the Minister just referred to, again, a staff member who had been fully vaccinated. Of the 64 residents, 60 have returned a negative test result, and over 40 of the 50 staff have also returned a negative test result. Obviously, those facilities remain in lockdown and we'll continue to support them as we normally do. But it highlights again how strong PPE arrangements, strong controls at those facilities, and of course the vaccination coverage of residents and staff, how important that is in stopping that onward transmission in these most critical locations. We still have a bit of a theme around construction. So one of our CBD construction sites has had a further 2 cases today, taking it up to a total of 8 active cases on multiple floors of that large office refurbishment. 89 primary close contacts at this point in time. I expect those numbers to continue to rise in the next few days. And again, can I please again encourage particularly those working on construction sites, I mentioned this a few days ago, it continues to be an area of significant concern. With the levels of community transmission we're now seeing across many of our suburbs, it is so important that we have outstanding controls in place at every single work site that is still operating. Without that, what we will see is transmission. We've been fortunate so far in this outbreak that we haven't seen widespread transmission at essential work sites. We really need to ensure we don't get into that territory in the days and weeks ahead. I've mentioned, and Ben's mentioned, significant community transmission now in our northern and western suburbs, and we are really starting to surge significant state and local resources into particularly the western suburbs and the northern suburbs. And can I give a huge shout out and thanks to our partners in the local councils, in community and primary health, in all other agencies of government around the outstanding support and cooperation we're getting at the local community level. We are now combining and building stronger partnerships than ever before in order to support people in those communities in situ, to ensure that people who need that extra help can get it where they are, and that we minimise unnecessary movement in those areas. That is a huge programme of work. We'll continue to talk about that in the days ahead. I can also thank the many community and civic leaders who are actively involved in that programme. Every single day of the week, we are having virtual or real meetings with people who are passionate about their communities and passionate about protecting their communities and giving them the support that they need. And can I say, please, both through the local leaders and through anybody who's listening, we are there to support you. We are there to support those people who are concerned about their health and who want to check in on their status and who need that extra help to isolate safely and to avoid passing coronavirus on to the rest of their loved ones. We are still, even as late as yesterday, finding cases where entire households are positive when the very first person has come forward to get tested, and where adjoining households and families are all positive at the same time, not only indicating that we've seen some level of household-to-household contact, but far more worryingly that coronaviruses have been in those situations for a number of days, possibly as many as a number of weeks. That makes it so much harder for everybody to trap down, and that is why we're seeing this rapid escalation of numbers, because as we're picking up new cases, there's a lot of cases sitting behind them who've already become infected over many, many days before. So please, again, my message as always is please get tested as early as you can. If you're concerned about anybody in your circle, in your friendship, amongst your workmates, encourage them to get tested. It's so important that we find a way of stopping it and not letting it get to others who you love. Finally, in terms of ongoing work, again, my message to employers and those people using our wider community facilities. If I look at workplaces and exposure sites, a third of them are supermarkets because we all have to go and get our food. A third of them are smaller community retail hubs, and a third are construction sites. They are the few remaining places where we are still seeing significant people at play. If you're in those environments, please be very mindful. Be very mindful that we're now in an environment where there is widespread community transmission. That person next to you at the grocery aisle may be positive, and they may not know it. They may not be showing any symptoms, but we're seeing transmission in that environment. The people you're talking to in your local neighbourhood store may also have been exposed. We don't know that. You need to please ensure, protect yourself, protect them from you and you from them. And similarly, and again at workplaces, encourage everybody, please, to adopt those safe practices so we can stop this thing and stop it from going down those trajectories that we saw yesterday.